Thanks for taking an interest in the OrthoCarolina Sports Medicine Shoulder and Elbow Fellowship. Here in the Carolinas, we take care of a very large, active, and rapidly expanding athletic population that competes year-round at all levels of sport, from high school all the way through professional teams.
We take care of the vast majority of the athletes in the region, from the high school level, college, and to the professional level. I take care of the Carolina Panthers, also the AAA affiliate of the White Sox, the Charlotte Knights. You'll get experience on the field. There's a lot of time that you spend with us in the locker rooms, really cultivating those relationships and learning a lot in that setting.
We feel that one of the strong suits of the program is that it really is two fellowships in one. A great sports medicine fellowship experience, and you also get a very solid shoulder and elbow fellowship all rolled into one.
We have a mentorship model at OrthoCarolina Sports Medicine Fellowship, and each of us spends a lot of time with the fellows and are really excited about training them and working with them to optimize their fellowship year experience.
It's a mentorship model that we have here, but we have flexibility built into the system as well, so that towards the end of the year in particular, but really throughout the experience, you can hone the amount of exposure you have to each of those elements to match precisely the demands of the practice that you end up joining.
I think the biggest take-home point about this fellowship is that it's very flexible. We do offer the ability to tailor your fellowship in the second half of the year into something that would be really useful for your job requirements. We often know that jobs are taken mid-year, and we want to be malleable to what you may need to fulfill this job in its best form. We will work with you at different time points to try to find out what your needs are, and we'll work around that.
I think one of the neatest features to our faculty is that we provide fellows with a uniquely diverse perspective.
Our faculty are young, excited, we're enthusiastic, and we all come from varied backgrounds. I do think that this provides a really excellent mentorship-based model where you can learn different techniques for the same procedure.
We bring the best of Rush, HSS, Columbia, the Mayo Clinic, ASMI with Dr. Jim Andrews, and the Carroll Clinic in Dallas, which gives fellows a patchwork of different approaches that covers the breadth of sports medicine.
You're going to learn 5 different ways of taking care of complex problems.
We spend time doing a lot of cadaver labs, a lot of surgical simulation type activities, which really join nicely with the surgical experience, which is, as the other guys have told you, is really second to none.
When it comes to the clinical experience, we've carefully tailored the exposure of fellows to provide fellows with a very high volume of clinical proficiency intended to allow you to dominate any clinical environment you enter into. So you'll leave here with a very high proficiency in both bread and butter cases, but also with sub-niche expertise in multiligamentous knee reconstruction, cartilage restoration, periarticular osteotomies, complex open shoulder, primary revision, conventional and reverse arthroplasty, as well as hip arthroscopy. And those skill sets allow you to penetrate even the most saturated of private practice and academic markets. On the academic side, for instance, research is something we find to be very important for leading in any clinical environment that you join. We think you should have a high proficiency in research, but we think that can be accomplished with an emphasis on quality over quantity. Just doing a couple of papers through the year that are well-designed, contributing projects is what we think is really vital for your education, and we give you a lot of help to do that. You have a protected research time each week throughout the year. There's a research institute that provides analysis as well as grant and IRB application support. And didactically, the same applies. We have a dedicated faculty lectureship, which is very comprehensive in terms of covering the breadth of sports medicine. There's a complex conference series at the end of each week covering the nuances of indications and the management of complications, and there are monthly scheduled cadaveric labs for fellows to hone their skills in.
We want our fellows to be future leaders in the field of sports medicine, whether or not they pursue academic, privatemic, or private practice jobs. We want them to be the best sports docs in their community and to be lifelong learners that are active in our society, such as AOSSM.
If you combine all those elements together, a unique, highly diverse, high volume, bread and butter, and high complexity clinical environment with a faculty that is diverse and teaching for the right reasons, with an academic program that is truly fellow first, and a clinical program that is tailored and proven to prepare you to dominate anywhere you go. And you have what we think is a truly unique and special program unmatched anywhere else. We're so proud of what we've built here, but even more privileged that you take a look at what we're doing. Best of luck in the application process, and we cannot wait to meet you.